So you need to be specific, because when you apply, they will ask you which one on the course that you want to study. You're either going to choose therapy, or you're going to choose nuclear medicine, or you're going to choose ultrasound or diagnostic. So the difference between the four of them is that diagnostic, mostly it's x-rays. That's the simplest example of imagine when you think diagnostic, think of x-rays. And ultrasound, think of babies, because those are the first reference that babies are being checked with those sonar machines. It's sometimes referred to as sonar, and those are the ones that actually report. They write reports. And then there is radiation therapy. Radiation therapy, they treat cancers. They handle the machines that treat cancer. Chemotherapy, when you go to those the departments, you will find them there. And then nuclear medicine is also a form of imaging. But the difference with it between diagnostic and nuclear medicine is that you inject the radiation, because with us diagnostic, we release it from the machine. It does not stay in the patient. So with them, they inject it into you and then take images.
Ladies and gentlemen, thank you so much. I have a gentleman here, Mr. Moyahabo Makhato. He's a radiographer by profession. But before I get into what he does and his work experience and all that, I'm going to just give him a chance just to do a brief introduction to tell us who he is, where he come from, and we'll get into his career. So, welcome, and over to you to introduce yourself and your brief background.
Thank you. So my name is Moyahabo Makhato. I am from Soshanguve. Part of my life I spent in Limpopo with my grandmother. Studied in my high school was done in Pretoria, Soshanguve High School, called Central Secondary School. That's where I spent half of my time. It's Pretoria and Limpopo, half.
Where about in Sosha?
Block UU. Currently now we've moved to Block DD.
Oh wow, you are not far from my home. My home is at Block BB.
Yeah, we just rode across.
No, great man, awesome. And Nyahabo, just tell me, you don't often get people who follow B-Red. I mean, there are not many people I knew in my community who did a B-Red. Actually, I have a story. I nearly studied B-Red. I think when I was confused after matric, I was applying for everything that I came across on in health.
Mm-hmm.
And I remember at that time there was a university, it was Vestec, before it merged with RAU to make UJ.
Yes.
And I remember I applied there, but apparently I needed to get a hospital before I start.
Mm-hmm.
And fortunately or unfortunately, I couldn't get the hospital. So I was not selected.
That's always the case with most people that apply for that.
Yeah. So I hope we'll be able to touch on that, because I'm sure people might want to get into the field and they get affected by that. Imagine, maybe I could have been a radiographer now. You would have been interviewing me. But anyway, tell me, how did you get to know about radiography?
Well, I didn't know. I think I came across it via someone else who was studying it. And at the time, when this person said, I'm studying radiography, or the first thing that came to mind was radio, I'm like, doesn't Medusa have radio? This is confusing. But at a later stage in matric, when I had to apply, because the first thing that I wanted to do was become a doctor, like most people who do sciences. And my mom said 3 choices. You can't have one. You need to have levels. You need to have the super one that you want. Then what's secondary to that? What is tertiary to that? That's how I came about radiography. I applied for it at UJ, and that was the course that I was accepted for. But at the time, I was still thinking about medicine, which was the first one, because since grade 7, I think I've been trying to become a cardiologist until that changed university. So I came across radiography via someone else.
And do you still have the aspiration to become a cardiologist?
No, that changed during the process. It really, I'm grateful for radiography to have changed my mind, because I think I would have changed. I would have suffered as a medical student or a doctor, maybe.
So did you go directly from medicine to radiography?
Yes. Matriculated, got accepted at UJ, and then went straight to radiography. So during the first year, I was still trying to figure out what is this. But because we did interviews with radiography, once you get accepted, you receive the preconditional acceptance letter. They will explain what you need to do. Like you said, finding a clinical practice, which is very important. And I figured that out by calling the department, because it was confusing on the letter to what do they mean when they say you must find a practice. Because remember, English is secondary to me, not even second, probably third on the line there when it comes to languages. So I had to call the department and ask them what is a clinical practice and how do I go about that. And they guided me to finding a practice. And I found my way to Bara to apply for a clinical practice, to go straight into radiography, because that's the condition that they accept you on to register.
Yeah, you did exactly what I didn't do. So that's why I did not get accepted.
Yes.
I think by the time I got to Bara, they were full at that time. And the West, I didn't even know Joburg, so I couldn't even maneuver the system there. But anyway, before we get into the profession, I want you to just break it down. Let's say a student is in matric now, want to do radiography. What is the first starting point? Where should they start?
I think as a learner, what you need to do first is to consider doing science. You must be interested in doing sciences, because one of the conditions on the prospectus, what they want is science, mathematics, and physical sciences. Life sciences, not so much. It might have changed, but it wasn't really a prerequisite, because people who did accounting did radiography. So first thing is to do science subjects. Another thing is to figure out whether you're interested in technology, because radiography is more of a technology career kind of path, because we work with computers. So you need to be interested in that as well, and be interested in working with people. So those are the things that you need to figure out, that you want to work with people. And the next thing that you need to do is to figure out which one, because radiography is a little bit diverse. There's 4 different types. There's a diagnostic, which I am a diagnostic radiographer. There is nuclear medicine. There is ultrasound. There is therapy, radiation therapy. So 4 of those. So those are the things that you need to think about when you think of radiography. Which one am I gonna major in?
And so if I'm hearing you correctly, physics is one component that is the bulk of what you do in radiography.
Yes.
Is there any other subject at a school level could you say it relates with the work that you do?
Life sciences is, because it just because, but sometimes in university we're still gonna do the basic anatomy and all of that. So if you haven't done it, it's not a train smash. But you just need to consider, if you matric, look for prospectus and check what are the current requirements to study it. Because most institutions will say that it's a must to do life sciences. Some will say no. So those are things.
Differ.
Yeah, they do differ a little bit. And also your marks must be at least above 60, because your universities accept according to the marks. So they'll start with the highest going down. So you shouldn't just aim for what you see on a prospectus to get into radiography. Yeah.
I get you. So let's say you have the marks now. then where to? Like, do you just fill a form? Where does looking for a hospital comes in? And do you need to look for a hospital, a clinic? Can you have affiliation with a surgery? And what is the reason for that? Maybe just to break it down.
Okay, so first thing, you need to apply to an institution that offers radiography. The institutions that offer radiography is TUT, Medunsa, now Sefako Makgato, UJ, University of Johannesburg. There's also Cape Peninsula, I think, and DUT. They now offer, and UP as well. They offer degree programs. So that will mean that it's a 4-year program. So you need to apply for that. With UJ, applications are free. They opened on the 1st of April every year. So you just need to apply for that. After you've gotten the acceptance letter, I'm going to be very specific to UJ because that's where I studied.
No
So
problem, no problem.
Your pre-conditional acceptance, they will tell you that you need to find a clinical practice. On the letter, there's a link actually, or a guide that tells you where do you find the clinical practice list. Because each institution has an accreditation. They accredit certain practices to help them with training, because they want to guide the training process and make sure that it aligns with what they want to teach and how they want to go about it. So these practices need to be registered with HPCSA for accreditation for training. So they need to be registered for training. Not every institution that has an X-ray machine can train a radiographer. So it needs to align with an institution. And most of these practices, they have to go through the university and offer that, okay, we want to train students, we think we have the capacity, and the university needs to come and assess, and HPCSA needs to assess as well.
Okay. So basically, you will, especially at where you are, you will get a list of the institute that you need to go to and find placement. So
Yeah.
that's the most actually crucial part, because without it will not be admitted. But then the question then is, when you are then admitted into the program, what does the program entail? How often do you go to these clinical places?
With UJ, it was 2 weeks. We started in first year around June, July. It's 2 weeks in, 2 weeks out. 2 weeks in, meaning that we're at the hospital or practice, because it's both. We train both at private and public hospitals. So when you apply, you choose which one you're going to apply to. You can apply to as many as you can, both private and public. And one thing I forgot to mention is that once you get accepted, the hospital also needs to accept you. So it's a dual acceptance. So with most of the hospitals, all of them actually, you need to go for an interview. They need to shortlist. So they get all these applications like the university does, and the university will obviously accept more people for security reasons. Some people might not go to that university. So the hospital will do the same, and they conduct interviews around November or October there. Once they have the shortlisting and have accepted students, they send the list to the university, and that's when the final acceptance comes from. The university has gotten the practice to say, yes, we want to work with this one, and then the university can allow you to register. So that's the first part. You need to get accepted on both sides. So the university can accept you, but the hospital might say, no, we don't want to work with you after the interview. So that will mean you cannot register.
And how common is the situation where a person get accepted by the institute but doesn't get placement? Like, is it a common thing, or are you likely going to get a placement?
I know people that have tried. They've done interviews twice, and they haven't gotten accepted. Because the questions in the interview, what they do is that they want to find out where are you mentally when it comes to working with patients, your understanding of the profession, because they need to gauge where are you interested, because they're also trying to kind of filter out people so that they don't have people who come and do first year and the next year they're out. So it's sort of a filtering system. The questions that they usually ask in these interviews about how you will feel about working or x-raying a patient, that was a prisoner or is a prisoner and has done something to someone that you know. So they want to guide those kind of things and get your understanding of that, and whether you'll be able to afford to pay your fees. That's was one of the questions that I was asked. And your understanding of the profession will be about radiation, its effect, all that. So if you fail to answer such questions, it's a problem for them. So you need to be prepared while you apply. Once you send your application, you need to start studying the program.
Okay. No, super. But then when you get accepted, I'm interested now in terms of the contents of the course. I mean, my exposure of radiography was people who are in surgeries, hospital, and they take X-rays. So what do you guys do? Like Monday to Friday in class, what do you study? What kind of courses do you study?
So our modules are diagnostic practice. They're a little bit different. We have applied physics as well. We have pathology, which is an introduction to pathology, just to get your understanding, get you to understand what they mean when they say inflammation. When a sentence or a word ends with itis, what does it mean? So that you have a general idea of things. And we also do professional practice. And those are the modules that we do in the university. So the diagnostic practice will help you to know positioning, because that's our job. We need to know positions, how to get the best view of anything. If the doctor says, I want to see this, or this is the condition I'm suspecting, you need to have an idea of which views to do. So that is diagnostic practice. We also do imaging technology, which is about the machines, because we need to understand the machines that we're working with, how when they show us this kind of thing, what is the problem, so that we can diagnose machines and be able to call technicians. So Monday to Friday, let's say on a university block, which will be a university week, we'll be doing those modules, covering those, and also doing anatomy and physiology. That is more aligned to life sciences. And the IMT, which is imaging technology, is aligned more to the physics part and the applied physics. That's why they want physics, so that you'll be able to pass those subjects. They go together. If you fail IMT, imaging technology, you can't proceed with physics. They do that. And then when we're at the hospital, that's when we start practicals. And hospital block will start June, July, like I said. And that is when you start interacting with patients. So, but the first week you are being a tourist. You're going on a sightseeing. They show you the hospital, where what is, and then after 2 weeks or so, that's when you will start with doing X-rays under guidance of a qualified radiographer.
Okay, and in terms of the profession, the work, I want to gain understanding that a radiographer's job, typically Monday to Friday, is it characterized by you taking X-rays all the time? Are there different aspects that maybe we don't know, common people, or is it X-rays every day?
What dominates our field is imaging. That's what we do Monday to Friday, imaging. And the other parts will you only get to do them when you are more senior, such as quality assurance, that is checking machines and handling the admin part. And also maybe when you are a chief radiographer, that is after being a junior radiographer, the next position that is available is a chief radiographer. So then you start handling the admin, which is a little bit minor because it's just rosters and the general admin in a department, making sure that everything is working, parts are being ordered, services are being provided, such as for the machines, doing the administrative work. But more what dominates us is imaging.
Yeah, I wanted to break it down. When you say imaging, somebody in Limpopo will not know what you're talking about. So
Okay.
I wanted to break it down in simple English. What do you do when you get to the office? What does this imaging look like for somebody who want to understand what is exactly this radiographer?
Okay, I'm gonna try to use a scenario to get and to understand it.
Please.
So what we do in the morning, first thing we do, make sure that we clean a machine. So a machine in our normal X-ray room, a general X-ray room, because we have different ones. So a general one, basic one that you can find in any clinic or hospital, will have a bed. We call that bed a floating table because we're able to move it in different directions. And we also have a tube. The tube it hangs from the ceiling and it moves around a lot. So it will have a negative side and a positive side. But as a patient, you won't see that. Only the radiographer will be able to see that. And it has a light that we use. So that light will show us where are we x-raying. So all the machines, if you're a patient when you're lying on that table or sitting and your arm maybe or your hand is on the table, you'll see us using a light. That light is a guide. It guides us to know where the radiation is going to go. And this light has lines and x's and y-axis and x-axis. So that's literally a vertical line and a horizontal line. So where those two lines meet, that's the central part, the middle of the X-ray where the radiation is gonna go. So that's what we do. We'll have a patient, they'll walk in, let's say maybe they're doing a hand, for example. So we'll put the hand on that area with a cassette. We have things that we call cassettes that capture the radiation as after it passes through the hand. So we'll put the cassettes, so this hand will be the cassette and this hand will be the actual arm. And the radiation will come from this side. More like when you use a torch and you put a hand and then the torch is behind. That reflection will represent your X-ray. That's what we'll see on a computer after we've released the radiation. So it takes only 1 second or less to just get the X-ray. So you just touch the button and then we get the X-ray and it's displayed on the monitor. And that is what we call our imaging. So that's the part.
Okay, no, super then. Awesome. And just listening to you, is it if you were to just maybe assess your work, for somebody might be interested in wanting to know, is it a very busy environment? Do you get a lot of patients you have to do x-rays? Can it happen where you are just sitting around, there's nobody for x-ray?
It depends on where you work. I'm trained at Barra, and at Barra you work. You work and you will feel that you are working, because it depends on the kind of hospital that you're in. So if you're in a tertiary hospital, you expect a lot of patients. But if you're at a clinic where I'm working now, there's few patients. A night can go without anyone coming in. So radiology depends on referrals. We work on referrals. Patients never come directly to us. They have to start with the doctors. So if the doctor does not see a need to do an X-ray, we will not be busy. So on a typical Monday, that's when we're busy post-weekend. When there was an incident or maybe the derby in Soccer City, we know that we'll be busy because most incidents do happen then. So it is a busy job. It is a busy job. If you expect to relax, it might not be the thing for you, because it kind of forms part of manual labor, because you walk around a lot. Radiographers work all over the hospital in almost every department we go to. So we service wards, we service people that come to the department.
Okay. And when you do the x-rays, do you write a report of the x-ray that you have done, or is just a matter of you just releasing an image and giving it to the doctor for interpretation?
Well, that was the sad part after I joined radiography. That was the sad part, that we actually don't write reports yet.
Okay.
Yeah, in other countries, if they do research, they'll notice that the UK does allow radiographers to do reporting. And this is after they've completed a course. In South Africa, that is still being discussed, and there's research that supports that we actually can. So what we are allowed now is to do image interpretation. It differs from a report that says you have a problem, this is the problem. It specifies what is the problem. So with us, we only assist doctors that have requested the X-ray. If they are struggling with interpretation, or we notice something before that is important that they need to note, we are able to call the doctor and tell them this is what we see. We see this, let's say, for example, a patient has been stabbed in the chest. So I can call the doctor and say, okay, I noticed there's this abnormality on the X-ray. Can you please note that when you do look at the X-ray? So we limit it to that imaging interpretation only, not reporting.
Okay, I'm asking that because, or maybe what do you need to do? Are you able to break down the three aspects? You spoke about the diagnostic, the nuclear, and also the radiation. Are you able to break them down? And at what point do one have to choose their field of specialization?
Okay. So with that one, we all follow the same process when it comes to application and interviews and all of that. But you need to choose when you apply. So you need to be specific, because when you apply, they will ask you which one on the course that you want to study. You're either going to choose therapy, or you're going to choose nuclear medicine, or you're going to choose ultrasound or diagnostic. So the difference between the four of them is that diagnostic, mostly it's x-rays. That's the simplest example of imagine. When you think diagnostic, think of x-rays. And ultrasound, think of babies, because those are the first reference that babies are being checked with those sonar machines. It's sometimes referred to as sonar, and those are the ones that actually report. They write reports. And then there is radiation therapy. Radiation therapy, they treat cancers. They handle the machines that treat cancer. Chemotherapy, when you go to those cancer departments, you will find them there. And then nuclear medicine is also a form of imaging. But the difference with it between diagnostic and nuclear medicine is that you inject the radiation, because with us diagnostic, we release it from the machine. It does not stay in the patient. So with them, they inject it into you and then take images. They can also do treatments as well. So that's the difference between the two. Can you repeat the question a little bit so I can finish the theme?
Yeah, but basically I wanted to know, at what point do you choose which one you specialize?
When you apply.
When you apply. Is it? So
Yeah.
you actually need to know all this information by the time you apply.
Yeah, you need to know which one you want to do, which one will work for you.
Is there some way where people can get like information about radiography before they apply? I feel like it's a lot you need to know before you apply.
Prospectors do help, because the usual one tells you, it explains each one of them. So they'll tell you the required marks, and then at the end they tell you about career prospects, and it will explain those. And I think it's a little bit simplified. And also you can go to LinkedIn is very important. As a learner, I think even when you're in high school, it's important to go there and search these people, and we are able to answer questions, because I do that most of the time. If you're interested, wherever you find me, whether it's social media, you can ask, or just Google these things. There's also gostudy.com. I think it's also a very useful website when you want to understand the different ones, how different they are.
So are you able to also maybe share, if you don't mind, your LinkedIn page for those maybe who might have question and want to connect with you? What I will do as well, if you don't mind, I will just put the link also below the video for those who might want to connect with you and gain more information and knowledge about it.
No problem. LinkedIn is Moyahabu Machado.
Okay.
Yes.
No, super then. I think for those who want to know more, because I think there might be a lot of questions regarding that. But now, getting into now the profession, or let's finish with the studies. My understanding is that it's 4 years to study to be a radiographer.
Yes.
Am I correct? So you come out with an honors in radiography. And do you have to do internship or community service afterward?
Yes, during your final year, that's when you need to apply for community service. So they'll give you a list of hospitals depending on where you studied. So when you were doing your practicals, you were doing them at a government hospital. I was doing them at Bara, so meaning that community service, I'm not allowed to do it in big hospitals. So I need to get exposure, because that is the purpose of community service, to get exposure of different environments, different hospitals, for further training, now training as almost independent radiographer or community service. So you're still treated as a student, but now you are senior. You're senior to the students, so it means that you also supervise students as a community service radiographer. So you do that. You do it for 1 year in all public hospitals. So you're not going to do community service in private.
Do you then have to do internship as well, or only
No,
community service?
for us, it's straight to ComServe.
And then when you are finished, you are fully qualified now radiographer to work independently.
Yes, after completing your community service, the supervisor at the hospital that you practice at or clinic that you are doing your community service at needs to sign a form for the HPCSA to change your registration from community service to independent. So it only happens after you've completed 12 months.
Okay. And are you guys able to be at your own practice? Obviously, maybe with affiliation with a doctor for referral and all that.
We can actually have our independent practices.
Wow.
So you have the money or have funding, you can have an X-ray department. You can have your own practice. Just that the process of getting that is a little bit tedious because there's a lot that goes into radiography and just establishing an X-ray department. Diagnostic wise, you will need to get licenses. There are multiple licenses that you need to get from the location that you want to choose to do your practice at. Because with radiation, you can't just release it anywhere because it has the ability to harm people. So it needs to be in a safe environment. So you need to prove to them that you can actually carry all that out, install a machine, and then get a license to operate the machine. All those things will come into play when you want to open an independent practice of your own.
And let's say you want to be part of a, let's say, group of professionals. There's a doctor with a surgery somewhere and you want to join them. What are the basic equipment that you need and how affordable are they? I know with psychologists you just need a test and you start. With you guys, you have got these big machines. I wonder how affordable are they?
They are not affordable. But I will not even try to decorate it, but they are not affordable. They're expensive, but you can always get secondhand ones. They always have these hospitals or private hospitals. They always try to release because our machines they're like cell phones. You get a new one. We always get excited when you get a new machine because it means better quality. April 11, then you want to get to the next 14. So when those departments kind of release the machine and say, okay, we don't need these, then the prices go a little bit down. So you can partner up with a doctor if you want. As long as you're able to prove to them that you can be able to buy a machine or they will be able to buy the machine for you. But my understanding is that doctors cannot operate machines. So either way, if they want to install a machine, they will need to partner up with a radiographer or an employer radiographer and get them to apply for a license for them to practice or operate the machine.
Is it difficult to get this radiographer license?
It depends on the experience as well. So you can't be new and wanting to do that. You need to prove to SAPRA, the South African Hazardous. I don't know the full one, but it's SAPRA. They need to confirm that you have the experience that they want. So at least if you have 2 years or 3 years to at least be able to practice on your own, you need that. And also you need to make sure that you are complying with the HPCSA continuous professional development, those CPD points, you need to get those as well. That certifies that you're actually a professional that has been training and will be able to train on their own. So those are part of the things that they need when they register you to practice on your own. So basically,
so continue.
So it's a license for the machine that they need to approve because already they've certified you as an independent radiographer, meaning that you can work anywhere you want. Now you want a practice, you want a license. So you want them to certify your practice and say that really you have the qualification that will be needed if someone has to own their thing. Because when you own it, compared to when you are in a hospital will handle the administration of the machine. The machine is under them. whatever happens in that practice, they are liable. You are just an accessory to the crime, should anything happen. But now, as an independent radiographer with a practice, you are liable for everything that happens. So basically, the license, before they give it to you, they need to make sure that they are protected and say they have agreed to give someone who knows all the laws that need to be known when it comes to owning a machine.
Okay. And when we speak about the machine being expensive, what are we talking about here?
A general X-ray machine can go between 600,000 and 1 million, depending as well, because the brand aspect also plays a role, because there's Philips. Philips is more expensive. Then there's the Chinese ones that are developed. Yeah, the prices are, let's just say, about 500,000, depending on which one you want to buy, because they're different ones. There's a portable machine that we use to go towards with. It also can go up to 1 million, depending on the qualities. Like cell phones, similar to cell phones, you choose which one, the pixels on the camera, all of that, they play a role when it comes to pricing the machine. And a general X-ray one that I spoke about that we usually have, it will also go around the 800,000 up 1 million there. And then we have CT scanners. Those are expensive. So if you want to have your own independent practice, you can't have a CT scanner without a radiologist. That one is definite. So a radiologist, different from a radiographer, is a doctor who does medicine and then qualifies, does specialty radiology. So those ones, we work hand in hand there. We can't have CT scanner. They can buy it, but they can't operate it without a radiographer. So because they set protocols on how to do the imaging aspect of it, how to do the imaging. So those ones are more expensive. They can go start with 2 million or 1.5 million going up. And then there's the MRI machine, which can go up to 32 million.
So tell me, these guys go at social, what transfer? You find a surgery there with the machine. How do they afford this machine, which costs so much?
Well, there are different ways. You can lease a machine. You can leasing the machine means that the machine is still owned by the company. Basically, you're paying rent to operate the machine.
Oh, okay.
So the nice thing about that is that when there's a fault with the machine, the company can come and fix it. So if you buy it and you don't secure the whole warranty, or they come with warranties, but you don't secure those, they come out of warranty. You have to pay for every part of it. So with licensing it and leasing it, they come and fix it according to the term that you have with them.
Okay. So basically, there's an alternative way to own one without having to afford buying one for yourself.
It's leasing it.
Okay.
Have monthly payments when they want them.
Okay, so which means you just have to make sure you've got clients to pay for that renting of that machine.
Yes, you need to have clients. That's one thing when you go into radiography. Also, and especially if you want to have your own practice, marketing and business skills need to be the things that you have. You can't just go and open a practice without knowing those skills.
No, awesome. So, Mr. Makatu, just for students who are watching, whether at matric, whether first years, anyway, who might be interested in radiography, what will you say is one of the joy of being a radiographer? You have been in the field for some time now. What is the joy of being a radiographer? What will make it attractive for somebody interested out there?
It's sort of like radiography is more like investigations. If you're into investigations, it's very interesting. And like I said, technology needs to interest you. So, because doctors come to us to find answers. And the tricky part about being a radiographer investigator vibe is that you find the answers, but you can't tell the patient. So that's the tricky part about it. But the joy that comes with it is just knowing that you are helping someone else and you are protecting patients. Because also as a radiographer, you advocate for radiation protection, meaning that you can protect patients from doctors who request unnecessary x-rays. So you know that patients are being protected from radiation exposure. Like I said, radiation can have effects. So you know that patients are being protected when you are there. And you are part of the most important team. When we like to call ourselves eyes to medicine, because without us, they wouldn't know where to start the search.
Wow, I like that. I like that. Eyes to medicine. And when somebody does radiography, where can they work? Beside the hospital, beside the clinic, where else can they work? I saw something on your CV about freelancing with Sasol. What are
Yes.
the other contexts where they can work?
So radiography, it has other aspects besides the clinic and the hospital setting. Radiographers work in mines, but the mine hospitals, and they work in occupational health like Sasol, with freelancing. So there we also do X-rays there. So there's no change. We are specialized, basically. We're more specialized to do one thing, which is imaging. So even in these different aspects, we do imaging. We can work in mines. We do assessments for people work in mines, their exposure to those dust and chemicals, and we just assess them and check that they're still healthy. So that will mean that we form part of occupational health. We can also work at SAPRA, like I said, South African Hazardous Part. They'll find that out. You just search SAPRA, you find what the exact name. So there you check with licensing and making sure that machines are being licensed to people that know how to operate them and they're being operated safely. And the other aspect is academia. So moving into academia means that you have to study further. You need to get your master's if you've done the BRED honors. You just need to get your master's and move into academia and be a lecturer and do research.
Okay. And in terms of job prospects, I've not heard about people who did radiographer who are at home, but from your experience, are they good job prospects or are they radiographers gallivanting in the township looking for jobs?
Radiography, they are. I think we are lucky. I was lucky. I had a bursary, the Gauteng Department of Health bursary, so I didn't struggle with getting a job. Straight from ComServe, I got a job. But there are also openings with radiography. Nice thing about healthcare in general, not just radiography, is that you are able to work while you're unemployed. For instance, like the practice that you said, doctors might need someone to come do x-rays for them, even if it's just for a day. You can go there and do your x-rays and get some amount of money. So being unemployed and staying at home and not having anything at all, it's impossible. It's close to impossible. But you can expect to, at least maybe if you're unemployed, stay home for less than 6 months. It's never beyond 6 months.
I'll take the close to impossible one. I think that's one of the good ones. It shows it's a good career.
Yeah, it is. It is. You just need to be sure of it.
Yeah. Thank you for that. Maybe just quickly, what are the future career plans that you have currently? I'm just wondering because you mentioned something about studying masters, becoming academic. Any future plans regarding your career?
With me is studying to become a neuropsychologist.
Wow. No. Welcome to our family. Welcome to our family. Welcome to our family.
Thank you.
Wow. Why neuro?
Well, neuro it interacts with what I'm doing right now, which is imaging. So neuropsychologists are a specialist in psychology. So they combine the behavior part with the anatomy part. So for me, when I'm doing scans, your CT scans, and I see the brain, I have these questions: how is this going to affect the patient?
Wow.
Process of treating it, is the patient going to be the same? Because sometimes you get patients that are shot in the head and you ask yourself, how is the recovery process going to be for this patient? What is going to change? But as an X-ray or technician or radiographer, it ends at imaging. You'll see the patient come in. Should they survive, they'll come in for the next imaging. So you just see that, oh, the brain is healing. There's healing on the bone. It never gets to the part of treating and just the part of the patient's life.
And so, have you started with the studying, or are you planning to do it in the future?
I've started. I'm doing it with UNISA because it kind of allows you to study and work at the same time. Self-funded. So I'm left with a couple of modules, 10 modules to complete undergrad.
Wow.
That were the honors.
Wow, 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 wow. No, this is inspiring. Look, I've actually interviewed a neuropsychologist. I think that video will go on next week. You might enjoy it. It will go on next week. I think I can't remember whether she's doing internship or she finished internship, but she's very knowledgeable about neuropsychology. So all the best with that. All the best with that. And I think actually you'll do well in it because it seems like your background is very well linked to it. I'm looking forward that we do an interview 3 years from now when you have just graduated.
Forward to it. It's good motivation for me to get there and do it.
Yeah, no. I think the only challenge they have now is that there's only one institute that offers it in South Africa.
Yes,
Which
UCT.
is, so I think that's the big issue. And I was looking at their numbers, how many they receive per year and how many they take. I'm actually busy with a video where I show all the institute in SA, the application they get and how many people they appoint. And it's shocking.
Yeah, I saw it's
Yeah.
hard work only that can get you to that. Because I
Yeah.
saw they would accept only an average of 70% and above.
Yeah.
Or to get into the thingy, and you must have done neuroscience.
Yeah. Look, I think with you, I think you'll make it. I saw somewhere that you are a top achiever. You got an award for something there.
Yes, I did receive. I was in the top 3 in high school, so that
Wow.
kind of assisted me in first year with funding, because UJ automatically gives a percentage of your studies paid when you are in the top of when you have your average must be above 75 from matric. So if it's above that, they pay a certain amount. The higher it goes, the more they will pay. And the other one was academic performance. So that was the Eugenius Club.
Yes. That's the one I saw. Yeah.
Yes.
Oh, super. Look, I think with your background, because I know with psychology, they always want some form of diversity. So with your background, it might add as an asset or an advantage when you go for the interviews. You must share this story. You must tell them how you came across neuro. So that
I will definitely have to find a way to
you are
do
the
them.
only one in your league.
I have to find a way to get them to get me on the program.
Yeah. No, Mang. I wish you all the best, and I definitely believe that you will. So all the best with that, and looking forward to meet you 3 years, 4 years along the lines and hear how it's going.
Thank you. We'll definitely be in touch.
Okay, super then. What are some of your last words of maybe motivation to any scholar out there aspiring to be a radiographer and follow your footsteps? Any words of encouragement, motivation that you can share with them?
Well, the first thing that I'm going to say that a lecturer said to me in first year is that you must know that radiography is not a get-rich course. So if you want to get rich quickly, radiography is not the one for you. It will offer you a middle class level, but you can also go to bigger heights when studying radiography by having your own independent practice, by doing more specialities, and just working hard in the profession to make sure that you secure yourself. So studying radiography is simple, it's more practical, and one thing that you know when you completed your studies, you don't have to refer to a book, because once you start with your practicals, it stays in your head. That's one thing that they need to know about radiography, is that it stays in your head, it's practical work. And so if you're not a lover of books, just know that when you're done, it's freedom, but you still need to have to study.
Wow. And can you specialize when you speak about studying? I heard you speak about one can do masters after their graduation, but to become academic, is there another form of studying for specialization beyond being a radiographer? There's something of that nature.
Yes. Yes, I forgot to mention this. You can also study and do I think it's 1 year or 6 months to do mammography, which is imaging of the breast. So as a radiographer, you can do that. You can also get a certification in CT, which is computed imaging. the machine is more shaped like a donut. You just go through it. And there's also MRI that you can study. It's also a 1-year course to study so that you can be more specialized. There's also interventional. So radiography is a little bit diverse, but it stays on the level of imaging. When you diversify it, we're still imaging specialists that work with images. So even when you specialize without doing academia or your master's, you stay in imaging. You just diversify it.
Thank you so much, sir, Mr. Moyahabu Makatu. Is there anything that maybe you feel I left out that you feel we needed to at least share with those who might be watching?
No, I think we've covered most of it. It's a pity we don't have people ask questions if they do not understand. But I'm available for questions if should they have any questions. But I think we've covered most of it.
Thank you so much. I think anybody watching this video, Moyahabu's link to LinkedIn is just at the description section. Just get it there. Keep in touch with him and ask as many questions as possible. The whole idea of this interview is to give you as much information beforehand. I think we've got a big issue in SA of career guidance, and we want to close that gap to ensure that people get as much information as possible regarding the different careers. So make sure that you connect with him. And I know him is very fast. He's very fast. Yeah, 1 day service. So, Dr. Makatu, thank you so much. I really appreciate your time and all the best with your career endeavors and future career path.
Thank you. Thank you.